Thank you, Shireen, for the lovely introduction. So I'm going to talk about busting myths on bone health and osteoporosis. My day job is that I'm a spinal surgeon, an orthopedic background. I work at the Royal Free Hospital. And a couple of years ago, I switched to a whole food plant-based diet for health reasons, and then really understood the science behind it and have incorporated it into this talk, which I'm hopeful you'll find useful. I was attending, like all of you probably, Rebecca Jones's talk this morning, so I hope you're not unpleasantly surprised that I'm talking on bone health and osteoporosis, but I think it's of a lot of relevance in our modern day. And I'll first of all get straight into it. We're talking about a few of the myths. I just want to show of hands, firstly, on the myths that are prevalent in osteoporosis, understanding and management. So the first thing is osteoporosis is not painful. For those of you who think this is true, put up your hands, just to get some idea. Okay, so quite a few of you still think osteoporosis is painful. Osteoporosis is due to calcium deficiency. Those of you who think that's true, put up your hands again. Okay, the vast majority of you actually think so. That's interesting. So we'll talk about this and see whether you change your perceptions about osteoporosis and your understanding of it. Now, cow's milk is a complete food for osteoporosis. How many of you think that is true?
A remedy.
A remedy, yes. Okay, there are a few. So most of you have come to the Vegfest, I expect, thinking that this is going to be a plant-based talk. And we'll look into whether cow's milk is actually a complete food for osteoporosis or to correct osteoporosis. The next one, which is a very controversial area, is whether vitamin D supplements are essential for managing osteoporosis. How many of you think that is absolutely true? Okay, so again, a majority of you think vitamin D supplements are essential for managing osteoporosis. DEXA scan, a lot of you would have heard about a DEXA scan, which is a measure of osteoporosis. Is that an essential investigation for osteoporosis or for postmenopausal women? How many of you think that is true? So not many of you think so. Good, okay. And finally, medication for osteoporosis. Does that work well to correct osteoporosis? How many of you think that is true and are taking medication for osteoporosis? Don't see too many elderly people in the audience. It's a bit of a shame because I was hoping it would be relevant. Only youngsters have come in, but a lot of people believe in osteoporosis sticking to the disease model. In other words, the disease model, what I mean by that is, if you have an infection, you correct it by taking an antibiotic, a genuine infection. That model doesn't work so well for osteoporosis, which I will go on to tell you is a lifestyle disorder. And it's a chronic disorder, like a lot of chronic illnesses that were talked about yesterday, cancer being one of them. And therefore, a tablet may not necessarily correct osteoporosis, but we look at all these myths. So another big myth is that bone is dead tissue. So a lot of us seem to think that bone, as we see it, is almost like a skeleton in a cupboard. And most people seem to have that impression that bone is dead tissue. So it's really a false impression, because bone has actually a very rich vascular supply. As you can see here, bone is a living tissue. It's composed of a really complex network of cells and protein fibers that are surrounded by calcium salts. There's an outer layer called a periosteum, which has, again, a rich nerve supply. And inside, there's a lot of canals which communicate with blood vessels. And the reason for all this is that bone is involved in calcium metabolism. So in other words, it maintains your calcium level within a very narrow range in your blood. And for that, it has to be connected to blood vessels. Now, just to understand osteoporosis properly, if I can show you at a cellular level, we are talking about two types of cells. And it's important that you all look at this, because understanding bone metabolism is related to osteoclasts and osteoblasts. So osteoclasts are the ones that remodel bone, so they take away calcium from the bone and remove old or dead bone or dying bone. Whereas osteoblasts, on the other hand, they are involved in bone formation. And there's a constant harmony between the two. So you have a synergistic breakdown of old bone by osteoclasts and laying down of new bone by osteoblasts. And these cells are living in your bone throughout your life. So even if you're 95 or 100, you still have osteoblasts that are living there and are involved in bone formation. Of course, everything in the system slows down after a certain age, and we'll go into studying that as we go along. Now, osteoporosis itself, however, is not painful till you actually break your bone. So it's not a painful condition. Most people seem to think of it as a painful condition. Only if you get a fracture or you have a collapse of a vertebra, and that too, only 40% of vertebral collapses are actually painful. So it's important to understand that a lot of spinal vertebral collapse due to osteoporosis may be completely without symptoms. So you may have a collapse there, and that is not uncommon at all. And you can only pick it up by seeing a height reduction. So if you see your granny is becoming shorter and she tells you she's becoming shorter, she's probably getting the consequences of osteoporosis by having a silent collapse of the bone, as you can see on this. Instead of a square-shaped vertebra, you have a wedge-shaped vertebra there, so it's crushed down. And you get a rounding of the back. People get a little bit of a kyphosis, as we call it. And this, in fact, results in bigger problems because the center of gravity falls ahead of the person, and this leads to further falls, which causes further fractures and worsens the degree of kyphosis or curvature. Now, the reason we seem to think osteoporosis is painful is we confuse it with another orthopedic term, osteoarthritis. Osteoarthritis, quite simply, is bone-on-bone contact because of the loss of articular cartilage. So you get erosions on the surface of a joint, and as a result, you get bone-on-bone contact, which can be extremely painful. So people confuse the two terms regularly and think osteoporosis is painful. Now, why are we actually worried about this? Ours is an aging population, as you know, in the UK. So we get 300,000 hip fractures in the United Kingdom. And as you probably know, all of them require surgery. We, as orthopedic surgeons, have progressed this condition quite rapidly in the past 10 years. So when I first started as a consultant, we'd inevitably be asked by an anesthetist to do an echocardiogram or some such investigation to check that the cardiac status of the patient was going to allow them to undergo an anesthetic and an operation. Nowadays, we inevitably end up operating on everybody within 24 hours, unless they're so sick that it would be almost certain that they would die under an anesthetic. So if you look at it, the biggest problem is that 30% of patients who have a hip fracture die within the first year, and therefore it's almost always a premortal condition. So it's a condition that people don't want to get, and that's the reason why osteoporosis is particularly important. Why does this happen? It's because people lose their level of independence and their mobility such that they decrease at least one grade within their mobility status. So if they were completely mobile without any walking aids, they end up using at least a walking stick and so on. So it leads to quite a degree of impairment of their overall independence. Now, if you look at our society, it's a sedentary society, unfortunately. So even as children, we sit down for breakfast, we go to work, and we sit down in a train or in a car. At work, we often stooped over a computer, and we're doing very little. And we've evolved, remember, from a foraging society which used to go out, hunt for food, or look for berries and food to eat. And then in the evening, because we're exhausted from our day's work, we sit with our popcorn in front of the television. So it's just to give you an idea, this is what we've evolved to become from a society that used to look for food all the time. So old habits have to change. And how do we do that? Or why should we do it? Why should we evolve into a society that does more exercises? Shireen and others yesterday emphasized the benefits of exercise. It's because of Wolff's law. Wolff was a German anatomist who said that in a healthy person, bone would adapt to the levels of load that it is placed under. So, for example, in astronauts who are in outer space, because they don't have gravity, their bones actually weaken considerably. Whereas if you load bone, it becomes stronger. So the external cortical portion of bone particularly becomes stronger as a result of loading bone. So if you look at bone loss, the bone quality is actually very similar in normal bone as it is to osteoporosis. It's not as if there's a qualitative difference, but it's the quantity of bone. And so you see a lot of empty spaces here in osteoporosis. And that's what actually happens unless we load it. So we have to do some method of weight loading bones. So we talk about weight-bearing exercises, because without weight-bearing exercise and without stimulation, the osteoblasts will lie quietly in your bone. Remember the osteoblasts? They lie quietly, where it's all the time osteoclasts are taking away the old bone. So over time, bone stock will reduce. And the main cause of osteoporosis is really our sedentary lifestyle. And that is the biggest cause of primary osteoporosis. Let's look at this now. These women who are working out in the field and are carrying big loads on their head, they are very unlikely to suffer with osteoporosis. Skipping is one of the best exercises, by the way, for osteoporosis, because you are repetitively stimulating bone. That jolt that you give by jumping or doing burpees or doing some form of skipping stimulates the osteoblasts to form better quality bone. We're always worried that our children are carrying heavy rucksacks on their back, and I get at least 4 or 5 mothers a month coming with their children who have back pain, complaining that they're carrying their heavy school books. And actually, the fact is that the children are actually sitting down for long periods of time. It's not because they're carrying these heavy school books. This old lady is never really going to suffer with osteoporosis if she does weight training at that age. So I think the basic message is try and build in exercise into your daily life. So if your council car park from the shopping center is a bit of a distance away and you grumble about carrying your heavy shopping bags, thank the council actually that they're helping you combat your osteoporosis. So we've looked at weight-bearing activity as being one of the essentials for bone strength. Let's now look at nutrition, that is the macro and micronutrients. And the other one, which I talked about as one of the myths, is about calcium. So let's look at calcium loss itself. This sort of method of doing weight-bearing exercise, so for those of us, osteoporosis is one of the few conditions where being of a slightly higher BMI, in other words, of a slightly higher weight, actually allows you to put on more bone stock. I don't mean the morbidly obese, because they have other problems. So if your BMI is well above 30, for instance, you're not likely to have very good bone stock. But if you buy these simple things, you can get it off Amazon or indeed any other internet site. So you have a weighted vest If you're very slender, you can just wear that and go for a long walk. Or put one onto your wrist or ankles. These weights will stimulate those osteoblasts that are lying quietly in your bone matrix. We've talked about a whole food plant-based diet yesterday, and I'll just reiterate, it's exactly the same for osteoporosis as it is for preventing hypertension, for preventing cardiovascular disease, for improving bone health, preventing cancer. It's the same diet. There's no real difference that we would recommend for improving your bone stock. So a diet full of healthy fruit, colorful vegetables, whole grains, and a diet that is full of legumes or beans, and no oil which is added, no salt, and no sugar that is added. So a little bit of salt is still a little bit controversial. Some people would add a little bit for taste, which is perfectly okay, but I think adding the excess amounts of salt that our junk food encourages. So this kind of food doesn't really do anything for our bone stock. And we call it junk food because it is empty calories. So all the nutrients are taken away from potato, which has been vilified as a bad carbohydrate, but is in fact an essential starch as long as you don't remove all the nutrients, as is done in French fries, for instance, which has nothing else other than empty calories, and it's been deep fried to an inch of its life. So this kind of food, especially aerated drinks, actually leaches away calcium from your bones. Now let's look at excess animal proteins. We studied that yesterday, or listened to Shireen talking about cancer, and we heard about the issues with inflammatory bowel disease yesterday. The human requirement is actually much lower than is commonly thought. So 40 to 60 grams is adequate, or 0.8 grams per kilogram of body weight. That is all we need in terms of protein. And we don't need that from animal sources, we need it from plant sources. The excess, remember, if you consume protein, it's not stored in the body. It has to be excreted, so it has to go through the liver and the kidneys, so it poses a burden, and animal protein particularly poses a very big burden on the liver and kidneys. So if you have a protein from animal sources, the calcium excreted in the urine increases 50%, and the risk of osteoporosis actually increases. So consumption of excessive animal proteins is one of the causes of osteoporosis. Now, why does that happen? It's because there's a mismatch between one particular dietary amino acid, which is called methionine, and this is a sulfur-containing amino acid, and it is present in very high amounts in poultry, fish, eggs, and dairy. And it's metabolized to homocysteine, which is a risk factor for heart attacks, stroke, depression, and Alzheimer's. But it's also metabolized to sulfuric acid, which dissolves bones. So it creates a mismatch in your acid-base metabolism and allows bone dissolution. Sulfur also feeds cancerous tumors, as we know from the China study and various other evidence that we have about the problems that animal protein causes. Now, the second myth that I had put up is about whether osteoporosis is due to calcium deficiency. Now, let's study that. I call it a myth, but there's some controversy around that. Now, there's little doubt that calcium is essential for bone formation, but it's not just calcium, it's actually way more than that. There's a whole set of other micronutrients and essential fatty acids that are involved in the formation of bone. So you have vitamin C, D, B, B6, and folate, as well as minerals such as boron, copper, magnesium, manganese, phosphorus, potassium, silica, and zinc. So there's a whole set of micronutrients or minerals that you get from planet Earth, actually. They're present in soil. They're not present, I mean, they are present in animal protein, in animal flesh as well, but they are present largely in leafy vegetables that we all eat. Now, what happens when you turn vegan or you adopt a plant-based diet? What's the first question all of you get asked? Where do you get your protein? Everybody gets asked this. Yeah? Now, the answer to that is that you get it from the same place the biggest land animals get it from: plants. You get it from plants. You get it as giraffes, elephants, the rhinoceros, the hippopotamus, and the gorilla get it from. The second question that you get asked inevitably is, where do you get your calcium from? And everybody, the moment you tell them a vegan diet, because most people don't know what it is, so if you tell them you don't have milk or a dairy product, they say, where do you get your calcium from? So where do you get your calcium from? Again, you get it from plants, which get it from earth. You know, it's like this meerkat asking a huge gorilla, no meat? Are you sure you're getting enough protein? So it's exactly the same question that a lot of vegans have to answer. Now, calcium deficiency is a very controversial area. So people have asked the question, does a dietary deficiency ever occur? Now, if you eat a junk food diet, you could possibly get that. Even as a junk food vegan, you could get it. But a WHO panel which sat down to look at a definite amount of calcium to prescribe didn't really come up with a definite amount. Now, UK Public Health puts it at around 1,000, between 1,000 and 1,200, I think. But it really comes from dirt. It comes from soil. And the cow gets it from the same source as we all should, so that is plants. So we should just cut out the middle moo and go to the straight to the plants. Now, a study about Bantu women, and this is there in literature, they consume no dairy products. And they take in about 250 to 400 milligram calcium per day. So it's a very minimal intake, really. They often have 10 children, and they breastfeed for 10 months. So throughout their reproductive cycle, they're actually having things that give away calcium from their bones. So you would expect them to have osteoporosis, but it's unheard of in that society. So Bantu women don't get it. Now, let's look at the other thing. What about dairy and calcium? So this calcium propaganda is one of the biggest things that the dairy industry has done. So if you look at it, America, where we get a lot of our sources of this sort of propaganda, it's a $100 billion industry in America. And about $212 million is spent on advertising dairy. So cow's milk is rich in calcium. It's also a rich source of protein. And remember the cancer risk as per the China study. So if you have a higher source of calcium, of protein, animal protein in particular, you're more prone to getting cancers. So overall, milk is likely to promote a negative calcium balance because of methionine and the acids that it has. So what about plant sources of calcium? So if you look at plant-based milks, so you can get milk from a variety of sources, as you've all seen. If you buy the organic variants, some of them don't have any added calcium or vitamin D. Now, because we live in a country where we don't see much sunlight, really between the months of October to around February, March, a lot of our vitamin D is actually synthesized by us in our skin from cholesterol. So it's worth saying that for all of us, if we are switching to milk, just look at the milks that have a little bit of added calcium and vitamin D, and that should be enough to tide you through those winter months. Some people would say that if you're vegan or you have a plant-based diet, during the winter months, it's worth adding or supplementing your vitamin D. Now, foods that contain it in the plant-based sources, you have a variety of foods. Some of them, for instance, spinach, calcium can be bound to oxalates, which are an anti-nutrient that is present in spinach. So if you add lemon juice and make it a little more acidic, the calcium becomes available to you from that. So These are all plant-rich sources of calcium. One of the other big problems is calcium thieves. So we tend to lose calcium through our urine because of overconsumption of salt, sugar, cola drinks, alcohol, and coffee, as well as smoking and foods of animal origin, as well as stress and cortisol secretion. So all these result in a loss of calcium. There's a big problem, as we heard of yesterday, about supplements in general. So if you look at calcium supplements, there was a big meta-analysis of trials with over 12,000 participants. So if you add calcium to your diet, if you take it as supplements, in other words, just as tablets, there's a higher rate of heart attacks. So 30% of people can develop heart attacks because the calcium just goes straight to your vascular endothelium and results in calcification and clotting. And this was published in our recent British Journal of Medicine. Let's look at the next sort of myth about whether cow's milk is a complete food for osteoporosis. Now, remember, it's high in protein, and it's a definite risk factor for breast and prostate cancer. If you look at it, it has a very high IGF-1. It's very inflammatory and actually promotes cancer. Milk is a complete food for a calf to grow from a 30-kilogram calf into a 300-kilogram cow. But it has these factors that make it very unsuitable for human consumption. Dr. John McDougall reviewed 57 studies in a book that he's written about the starch solution. And he said that in these 57 studies, 57% of the studies showed no benefit from dairy, only 29% showed a benefit, and 14% were actually harmed. And these studies included a lot of studies that were published by the dairy industry, actually, or promoted by the dairy industry. So you can imagine that the truth is a little bit further away from that. So in postmenopausal women, we know that they get more bone loss, and soya milk may protect against it. So if you look at dairy consumption in various countries, in the Nordic countries, so Finland, Sweden, Norway, etc., they have a much higher consumption of dairy products. Their rate of fracture neck femur increases as they go for a higher dairy consumption. Let's look at vitamin D supplements and see whether this is essential for managing osteoporosis. So I just have a little bit of a caution about supplements in general. Nature is really quite smart, as Colin Campbell says. So the concept of holism has to be taken in. So if you look at plant-based foods, Dr. Colin Campbell describes it beautifully as the phytonutrients are like as if it's in a symphony. So they act synergistically together with a whole lot of factors. So if you look at the reductionist theory, namely you can put something inside a pill, it doesn't quite work. So if you look at people understood that, for instance, lung cancer behaves differently in people who eat a lot of carrots. So they plucked out the nutrient, that is the Oscar-winning nutrient from carrots, namely beta-carotene, and they put it into tablets. So you had beta-carotene supplements, and that actually increased or modified the behavior of lung cancer so that it became worse. So it's a caution. Try and eat it in the whole food rather than in the form of a supplement. Let's look at vitamin D supplements and the history of it. It's become really quite a profitable industry, and it got popularized in Boston by a scientist who did that. And the global sales in the United States have gone up to 6 billion of vitamin D and associated products, including the diagnostics that go around it. So vitamin D is definitely important in many areas, in the United Kingdom in particular, because, as I said, sunlight is a bit of a problem, but the importance has probably been exaggerated a bit. So if you look at the benefits of vitamin D, it reduces inflammation, it reduces autoimmune disorders, it improves brain function, it reduces cancer cell growth, There's a beneficial effect on immunity. It also enhances mood and sleep and reduces risk of heart disease. So all this is touted, but unfortunately, it's by people who are making supplements. But it's true. All this is true. In fact, it's been proven beyond doubt that more cancers occur because we are afraid of stepping into sunlight. Now, there is a caution, of course. Skin cancers are increased by exposure to sunlight. But the number of cancers that occur as a result of people being afraid of stepping into the sunshine is probably much more than the incidence of skin cancer. So if you look at UV light, there's one particular type of UV rays, so UVB light, which in the United Kingdom is around lunchtime or midday. And remember, if you sit inside a car and allow the rays to come onto your skin, the UV light is filtered out, so you don't actually get the benefit. You actually have to expose your back and neck, ideally. In people of Caucasian origin, 20 minutes to half an hour a day is enough to generate almost half your week's supply of vitamin D. In people who are more pigmented, you have to expose yourself for considerably longer. So this just gives you an idea of sunshine exposure. Now, is a DEXA scan essential to manage osteoporosis? DEXA scan is a method of measuring bone density, and it's quite a simple machine. You lie in front of it, and it measures it in 3 different areas and gives you a number. Now, that number gives you, so you get a T-score. In other words, you get a number that is, either -1, so you're comparing it to race and sex-matched individuals at a younger age, at the optimal age, which is 30. 30 is when our bone mineral density actually maximizes. So if you have a figure that comes out between -1 and 2.5, we call it osteopenia. And if we are below -2.5, it's called osteoporosis. And you often get a graph that looks something like this. Now, remember one thing, osteopenia is not a disease. It just means your bone density is a little bit lower. Remember always that your osteoblasts are still sitting there waiting to be stimulated. So if you have osteopenia, do what has caused, deal with the problem, namely the fact that you haven't stimulated your osteoblasts. So do weight-bearing exercise, and that will stimulate your osteoblasts and generate new bone. So if you look at age and how the bone behaves, so in women, there's definitely a loss around the time of menopause. So around 50 years of age, you get a reduction in bone stock. Your maximum bone strength is between 30 and 40. So even if you haven't been particularly active as a teenager, you can generate a greater bone stock at that age again. Men are more protected because we don't really have a problem. Our androgens allow for bone mass formation to stay there. So if you look at risk factors, these are the various risk factors. But primary amongst them is a sedentary lifestyle. So as you can see, the history of a prior fracture, being thin or too skinny, smoking, alcohol abuse, all these are risk factors in having a lower bone stock, as are these conditions. So if you have steroids for rheumatoid arthritis or inflammatory bowel disease, or you suffer from any other condition that requires medication constantly, then our bone stock will decrease. One of the important things in managing osteoporosis is to prevent falls, because falls can result in a fracture of the hip or a fracture of the spine that results in big problems. So it's important to review medication regularly for blood pressure, to correct eyesight, and to look at the home environment to prevent falls. But primary amongst these, as I said earlier, is to activate your osteoblasts, to do regular exercise. One of the big problems in elderly is the fact that we get sarcopenia, or the loss of muscle. And it's important to do weight training in addition to the 150 minutes that we say is necessary for cardiovascular health. Finally, I just want to talk a little bit about medication and whether it works well and has no risk. Now, we've talked about vitamin D and calcium, and a little bit about the conditions that cause these disorders, such as anorexia. I just wanted to touch upon bisphosphonate, which is a very popular drug that is used in postmenopausal women. Now, it's a drug that actually inhibits your osteoclast formation. So it prevents the activity of osteoclasts. So one would think it's a good thing. It stops bone from going away. Now, actually, all it does is it makes your bone look denser on a DEXA scan. So you get pleased that you can see a number that's actually improving. But what it does is it makes your bone more brittle, and nobody will tell you, your doctors will usually prescribe a drug more happily than tell you you've got to change your lifestyle, namely do more exercise, especially weight-bearing exercise. It also has a horrible complication called osteonecrosis, where the jaw can die as a result of blood supply lack, and you get loose teeth and your teeth literally fall out. So it's got serious problems. Now, what if you do actually end up getting a fracture from osteoporosis? One of the earliest fractures that people get is a fracture of the wrist, and that should warn them that they need to mend their ways and improve their lifestyle a bit. Once you get these fractures, it's unfortunate, but it's often a spiral downward. So I spend a lot of my time dealing with these kind of fractures, which are hip fractures. So this is an intracapsular fracture, and we often have to put in a hip joint so that people can walk. And this is a fracture which is called an extracapsular fracture. So it's actually a shaft fracture of the femur, where we fix it with a screw and a nail device. But it does reduce your mobility considerably after this, as I said, 30% mortality within the first year. The other bit of my life, my day job, I deal a lot with spinal deformity as a result of osteoporosis. Now, as I said to you, 60% of people who have these fractures don't actually get symptoms. But you can imagine somebody who's as bent over as this lady here will have a decrease in appetite. Her mobility will go for a 6 because, in fact, her center of gravity is way ahead of her. So she may have frequent falls as a result of it. And they come up sometimes with this kind of a fracture, where you can see that the shape of the vertebra has changed from this shape to a wedge shape. And we have to sometimes do what seems like a clever little operation of going in percutaneously and putting what we call a spine jack. So this is a correction of the vertebra to its original shape. But we also have to put in bone cement so that we strengthen the bone and prevent it from refracturing or getting squashed down further. Finally, to summarize, the idea is really to prevent falls and fractures, and that it's really quite important in our lifestyle to build in exercise, especially weight-bearing exercise. But we should do all the other things that prevent falls. From a dietary perspective, a whole food plant-based diet with no oil and no added sugar and salt, and rarely supplements. So we would probably go as far as saying that the supplements that everybody who's on a plant-based diet requires is a vitamin B12 supplement, and also vitamin D, particularly in the winter months here, and medication very rarely. Finally, I'll just end with leaving some useful resources for you to look at, which I think I've found very useful in my journey into a whole food plant-based diet. Many thanks.